Now, I'd like to have a quick discussion with you about hormone replacement therapy. Please do discuss this with your doctor. For anyone that has had to deal with premature menopause or surgical menopause, HRT is an absolute lifesaver. But I also want to just make you aware that a recent Lancet analysis, which brought together evidence from around the world, suggested that for women of average weight, 5 years of hormone replacement therapy from the age of 50 would actually only increase breast cancer cases by about 1 in 50 women using combined estrogen and progestogen, and about 1 in 200 women with estrogen-only preparations. Now, these figures do double after 10 years, but it should also be clear that this 2% figure, this 2% risk, is actually very small compared to the increased risk of breast cancer from obesity, from regular alcohol consumption, and also from lack of physical activity. For example, when you're postmenopausal, your risk of breast cancer can increase by about between 20 and 40% with obesity compared to average weight. And just 3 alcoholic drinks a week can increase your risk by about 15% compared to women who are teetotal. So I think it's worth just giving you these figures so you can actually aim to arm yourself with information that will help you decide whether HRT might be right for you. Body identical HRT is something that your doctor should be able to talk to you about, which has fewer side effects and risks. You can also get HRT in the form of patches and gels rather than tablets, which are useful because you don't have to metabolize them through your gastrointestinal tract. And I also want to draw your attention to the fact that the gold standard of hormone replacement therapy, which is an estrogen gel or a patch with a micronized progesterone in tablet form, this actually does not increase your risk of breast cancer within 5 years of taking it, according to a 2018 systematic review. So I'd really like to just highlight that for you, because understandably, many women have been very reluctant to even consider HRT because of the fear around that increased risk of breast cancer. And I think the main reason for that was the Women's Health Initiative study from 2002 and the Million Women study from 2003. And what happened with those is that with the Women's Health Initiative study, it was a US study, and it was stopped because there was a concern due to the increased risk of breast cancer, heart disease, strokes, and blood clots that was reported in the combined hormone replacement arm of the study. However, Professor Langer, one of the principal investigators of the study, wrote a paper saying that when the initial results were assessed, most of the participating investigators were excluded and had not approved it. And he also said that the headline of the study was irresponsible and factually incorrect. The reason for this confusion, I think, is that the average age of the participants in the study was actually 63, which is more than 10 years beyond the menopause. And that's quite different from women who might be sort of undergoing hormone replacement therapy from the age of 45 up to 50 and 55, because maintaining levels of estrogen at menopause is different from reintroducing it 10 to 15 years later. There are many women there that had already developed the risk factors for heart disease before they started on the HRT. And when you look at the data, it was actually true to say that there was not really a statistically significant risk of breast cancer. But because of this study, the number of women taking HRT dropped by about 66%. And this is basically an entire generation of women that were sort of scared into stopping their HRT, and then had to endure things like hot flushes again, bone deterioration, memory loss, vaginal dryness, hair loss, aches and pains. And it also stifled new research because women were too scared to take it and physicians were too scared to prescribe it. So I do think, again, that it's worth mentioning HRT is one of the most appropriate treatments for symptomatic women within 10 years of menopause without clear contraindications. Now, it's not going to be suitable for everybody, especially if you have a history of breast cancer. So it's worth discussing that with your doctor if you're interested. But also, it's worth highlighting here that there is, in fact, a potential risk from not taking HRT. There was a BMJ study from 2012 that followed a large group of women taking HRT for 10 years that began soon after menopause, which is when you're supposed to start it. And what they found is that these women actually had a reduced risk of mortality, reduced risk of heart failure and heart attacks, with no increased risk of cancer, blood clots, or stroke. So that's just something to think about. If you have been scared of the prospect of HRT, but curious about trying it, then hopefully this education may be interesting to you, and you may want to discuss it further with your own doctor. I'd like to share now a little case study. My patient, Michelle. Now, she is a lovely lady, and she is a real example of the power of plants for improving health around the menopause. Now, what happened with her is that she came to see me, and she was pretty desperate. She came in tearful. She was getting severe period cramps, hot flashes, and frequent episodes of anxiety. She was tired all the time, and she'd regularly wake in the early hours of the morning in a panic. And she would describe it as 2 weeks of hell every single month, in which the cramps were unbearable and she was having breast tenderness. She said that she was not a medication person, and she admitted to me that she was not likely to take any treatments. We'd done standard blood tests to rule out things like thyroid imbalances. And I told her that I thought she was perimenopausal. So she was around the menopause when all of these wild swings in estrogen were beginning to take place for her. She was still in this sort of limbo land of having periods that were heavy and painful, but also experiencing the crippling symptoms of menopause. She was not depressed. She wasn't lacking in purpose. There were no major stresses in her life. So I decided to talk to her about simple lifestyle measures that could improve her symptoms. And I briefly explained to her that a whole foods, plant-based eating pattern may help her. And she was initially quite skeptical. She told me that she was already healthy. She didn't really see how it could help. And she really felt like she'd tried everything. Now, I understand this because I have a lot of patients that feel the same. And I said to her, I understand that you might be feeling this way, but here are some resources. And if you want to try it, you can. Unbeknownst to me, she had decided to go and buy a plant-based cookbook and conducted her own online research after our discussion. And she decided that she would, in fact, start to introduce tofu or edamame beans every single day, as I had suggested, that might help her with her flushes. She cooked all the recipes, and then she noticed her mood swings begin to subside. Her periods got lighter. She began to experience a better sleep at night. She wasn't getting period cramps anymore, and her anxiety had also improved. So she came in to see me about 10, 11 months later, and she looked like a different person. She came in smiling, and she said that she feels as though she looks younger. She said the bagginess around her eyes had disappeared. She said she'd lost about 9 pounds in weight. She hadn't been trying, but she just felt a lot more vibrant. She felt a lot more energetic. She wasn't getting any bloating anymore. And she was confident. She was happy. And I felt that she was truly vibrant. And I love to share her story because this really does show the power of plants to improve so many aspects of our health that we may not have otherwise realized. And she also taught me a really valuable lesson that you should never lose hope that you could feel better than you currently do. And in this case, obviously, plant-based eating was just the change in perspective that she needed. And I thought this was a lovely way to round off our menopausal section of the talk, to give you a feel for what you could hopefully achieve in your own life moving forward.